election rallies have to do anything with the COVID-19 surge? This is the question that everybody's been asking all over the country, including Assam. Assam's present Chief Minister, Dr. Himanta Biswa Sarma, has been saying all along that election rallies are not responsible for the COVID-19 surge, at least insofar as Assam is concerned. Perhaps he may now feel his views are vindicated by what our own scientists are telling us, that election rallies may not be the cause for the COVID-19 surge, as there are no convincing data to show that election rallies have led to the surge. But what has, and where there's data, is of people that have come from the outside, which would have led to the rise in the number of COVID-19 cases in Assam. Though this may go against the popular belief and my own belief that election rallies actually could provide an ecosystem for the virus to thrive. And also remember that in most of the cases in the other states in the country, there had to be a super spreader event for the cases to rise. And which is why we are seeing the kind of decisions that have been taken by the government to put in a lockdown in place and to bring in restrictions to ensure that we can contain the cases. And this also includes the state of Assam. But let us go with what the scientists and the medical experts are telling us. In this edition of the Doctor Speak at G+, we once again speak to our very own scientist, Dr. Biswajit Barkakoty of the Indian Council of Medical Research at Dibrugrah, and find out from him what are the reasons that have led to the rise in the number of COVID-19 cases in Assam. Let's also find out why election rallies may not have been the cause for the rise of COVID-19 cases in Assam. Also, what is black fungus? About RT-PCR and false negative reports, about home quarantine, and about the precautions that we need to take going forward. Welcome, Dr. Barkakoty. And the first question that we want to ask you is, what are the strains that you're working with, and when did these strains come into the population?
Doing a lot of other studies, actually, even the strain identification and all, the sequencing of the strains. What are the, in fact, as we have mentioned earlier, the Indian variant and the UK variant, the UK variant were circulating in February and March in Assam. So few cases we have detected in Dibrugrah and Tinsukia district during our routine sequencing of these viruses. So
and how would it have come into the population, doctor? You said February, so it's quite early. And we had election campaign starting only in March. So as early as February, how did the UK variant and the Indian variant come into the population?
See, there were sporadic cases will be there. Sporadic cases, 1-2 cases will be there. And this was not an outbreak. So in February and March, what we were detecting were cases from airports and railway stations, most of the cases. 1 to 2 positive cases we are daily getting from the airports. And what we are seeing that at one time daily in our lab, we are getting 20 to 30 cases from airport positive. And from the railway station, another 20-30 cases positive in our lab. So suddenly the inflow of positive cases from the airports has increased tremendously. So ultimately, this was the Indian variant that drove the surge in even Assam and Northeast. And what we have seen is that this election rallies and all those, because during February and March, we are not detecting it in the community. We were also surveying, because these were, I'll not go into political details of all those things, because when you do rallies in open air, there is limited chance of transmission, because the air dilutes, your movement of the air dilutes the virus, and the intake of your the loading dose that you are required to get infected becomes minimum. But you have a higher chance if you are in a closed room or you are with a positive room and in a closed environment with no cross ventilation, you are in a higher chance to get infected. So by estimating that only the election rallies has caused this may not be correct. So there needs to be more analysis on those things.
Thank you, doctor, for clarifying that, because there've been some, to and fro from different parts. Politicians have defended themselves, other people have questioned them, but that's all right. At least you've clarified. One thing that I want to ask you, because you said closed rooms, a lot of people tend to stay indoors these days. Is it okay for them to stay indoors? Do they, because they're closing their windows and doors, should they open the windows in the daytime, which they normally do? But what else should they do?
Absolutely, they have to open their windows. There should be ventilation. There should be room sense, at least 6 to 8 room air sense in a room per hour. That is recommended, or else your loading dose of the virus will be very, because this virus transmissibility is higher, and you should not lock yourself up. Means anybody coming into that room will get infected if you are locking yourself up in a room and you are infected. So anybody coming into that room will get infected. So the main thing is that you have to have a cross ventilation and a ventilated room that you have to be in.
A cross ventilation and a ventilated room, because this is an Indian variant and it has mutated. Is it the reason why RT-PCRs are sometimes giving up false negative results, or what is the reason?
RT-PCR that are recommended by the ICMR are not giving false negative result. So because these are based on multiple probes and genes, not targeting only one specific spike protein gene or the nucleocapsid or the ORF. So these, we are detecting multiple genes at one time. So there is very, very less chance that we'll get a negative, false negative result. The false negative result that you get is due to maybe error in the sample collection, or sometimes what happens, maybe during incubation period, the virus may not be there, and sometimes within next 24 hours, you will get the virus. If you are unsure and you have symptoms, within next 24 hours to 48 hours, the test should be repeated.
We are also hearing about black fungus. So could you just explain to our viewers what is black fungus and how dangerous is it for people that have come out of COVID?
See, when you are treating a disease with a lot of medicines, antibiotics, and you are treating with steroids, that is either dexamethasone or methylprednisolone, so you have opportunistic infections actually. And these some opportunistic infections like mucormycosis, what we call, is a common name, black fungus. So they can actually come up, and we need to have antifungal treatment. So these are some of the infected, and when it goes in a rampant, I mean to say in a epidemic proportion, you have to look at the source, where it is coming from. Some of the sources may be the humidifiers that we are using in the oxygen cylinders, that you to humidify the oxygen, or the lines, because these are some of the things that you have to use clean water, and there is a lot of care that needs to be taken in case of COVID-19, changing the masks and cleaning the masks and all those things, because you are giving steroids also, and also a lot of antibiotics and antivirals you are giving, and naturally some opportunistic fungi will come up as in the cases. So that is what we are seeing in these cases actually.
Now, increasingly, doctors are recommending home quarantine, isolation, and treatment. Can you please tell us a bit more about what is home quarantine presently, and what are the things that one needs to look for while in isolation at home?
The data that are coming out from the state, and we need to be very careful what is happening, how because this time home quarantine is the main idea. Home quarantine, a lot of people are in the home quarantine, and people without monitoring may die in their bed if they are not monitored properly. So that has to be looked into by the authorities actually, how they are monitored properly.
Sorry, doctor, just there again, I just want to ask something which I think is crucial. Is, so you said home quarantine and people have to be monitored, medical experts, doctors have to be there, they have to be assistants. But are there any additional symptoms to the ones that we've already got to know last year, which actually are things that people must know when they are in home quarantine, and people that are looking after them?
See, last year what is happening was that there were institutional quarantine. Most of the cases that were positive may be asymptomatic, because I'll tell you here only, 90% of the COVID cases are mostly asymptomatic or mild infection. 90%. Okay. Even in this second wave also it is similar. Maybe mild infection of just a running nose or something like a mild sore throat. But most of them even doesn't know. Even we conducted a sero survey where we saw that around 89% people didn't know that they had antibody, they had fever or something like that. and they were positive for COVID-19 antibodies. So it shows that this infection, 90% of the people don't elicit much of the disease, and even they don't need the vaccine. But we do not know if 90% of the people doesn't need the vaccine. Only 10% of the people need the vaccine, but we do not know who are these 90%. So we have to give 100% of the vaccine to all the people. If there was a test that we can detect that this person doesn't need the vaccine, so it would have been an easy test. Easy way to distinguish between that this person will go for a serious infection and this person will not go for a serious infection. So there are a lot of we have learned a lot of things, but home quarantine was the mainstay this time, and the serious cases are being shifted to the medical college and other specialized centers. But sometimes the cases come very late with SpO2 level less than 70. So sometimes it becomes difficult for the medical college hospital to see. So we have not seen a very drastic increase in mortality till now. And whatever we are expecting that there is a difference between the infection fatality rate and the case fatality rate. What we have calculated is that out of 10,000 people infected by COVID-19, 4 to 5 people will die. Out of 10,000 people infected with COVID-19. So with that estimate, we can estimate if we achieve a herd immunity at 60% or 65% in Assam or in all over India, you can expect that between 3.5 to 4 lakh people will die due to COVID in the country. If it is a natural way to achieve the herd immunity. But we do not want to achieve the herd immunity by natural way. We want to intervene with vaccine.
And Doctor, finally, I want to just ask you, of course, we've talked about precautions and all these kind of things. In terms of Assam again, and let's say they're adding the other states of the region, what would be your advice to people that are sort of now, everybody is confronted with this challenge. People have a fear at the back of their mind. So what's your advice to people, and what are the other precautions that they should take going forward?
Yes. So last 1.5 years, people have seen corona. Sometimes you tend to get very casual about it because you don't see dates out here. But what we are seeing is that there are a lot of, in the media, you will see a lot of things coming up that this works, this doesn't work, this works. So there are, what we can see, recommend, because there are some good studies where you see vitamin D has a major role. Even some studies are showing that between critically ill and those having asymptomatic, and vitamin D, those who are critically ill has a very low level of vitamin D compared with those who are asymptomatic. So these not only single study, multiple studies has shown that so vitamin D level as a whole in Indian population is more than 40 to 50% has a deficient. I mean, it's lower than the normal limit of 20 nanogram per ml. So it is better to take a prophylaxis of vitamin D because these are also act as anti-inflammatory. So I didn't mean to say that you go and hoard the vitamin D. So it is even you get it free in the sunlight. Your exposure to sunlight also gives you vitamin D. So that is one reason. But apart from those, what you can give is that people tend to say that you have more immunity, you can defeat the virus. That is not true. Immunity, in fact, it is the reverse. It's a that you are taking immune boosters and that you are going to defeat it. It is not like that. It is those people, even high athletic people, or they have very good immune system, may succumb to this disease. It is because your body's immune system attacks you, cause ARDS, or may cause severe disease, what we call a cytokine storm. So sometimes that's why physicians are giving steroids or your like dexamethasone to suppress the immune system's hyperimmune state or the body's own immune system attacking. Actually, that
so
causes
more medicines. The medicines that doctors are giving, you say, are immune suppressant, and they give that because to keep the immune system at a certain kind of certain balance.
But you cannot suppress it more. Then more virus will grow. Then it will have a different effect. So those doses are given in an optimum dose, a low dose of dexamethasone at 6 milligram. So you have to maintain and monitor how much you are giving, at what stage you are giving. So that is a very critical way how to treat the patient. So ultimately, it's a sort of the thing that clinicians decide what patient to be given the steroids and what patients to be given the antivirals and what are the patients to be given IL-6 inhibitors or cytokine inhibitors, because they are the main cause of your ultimate fatality because of high level of cytokines that damages your lungs and other organs. So ultimately, some are there cytokines or IL-6 inhibitors and other are there in the market, which are very costly. But if you use it at the late stage of the disease, it doesn't work. It doesn't work.
And all these medicines and steroids that you're talking about has to be taken under medical consultation.
Yes, that has to be taken under medical consultation, and you have to monitor the blood levels and what person needs. Without doing a blood test, you are not going to give those medications. So there are markers in the blood that shows that this person is going for a serious disease, or this will have some markers like high neutrophil count or C-reactive protein or serum creatinine or LDL high level. So there are a lot of markers are there in the blood that shows that this patient needs more care and more treatment education.
Right. Thank you, Dr. Barkakoty, for providing us an insight into the COVID-19 surge and the present situation in Assam and the rest of the Northeast. We look forward to talking to you again. Thank you so much.
Thank you so much. Thank you. Okay.